I wanted to first thank everyone in the community for coming out to discuss this very important topic. As we've all heard, Columbine, Parkland, Virginia Tech, and Sandy Hook, and so many more that we probably haven't heard about, are all school shootings that have now seemed to become commonplace within our society. Since 2000, there have been more than 188 shootings at schools and universities across our country. As the shootings grace our television screens, information slowly comes to light regarding not only the innocent victims, but as well as the suspects. And there is one common factor that presents each self with tragedy that passes us by. The alleged shooter has exhibited warning signs of mental illness that went untreated or undertreated. Now, how has this mental health epidemic reached the level that it has in this country, and what is the solution? One serious flaw in our current system is that it is just simply too difficult for families to get help for their adult children with a serious mental illness. Now, the Community Mental Health Centers Act of 1963, which was enacted under John F. Kennedy, was a watershed event that spawned the modern community mental health movement. It eventually led to much more organized and comprehensive care delivery systems, increased attention to prevention and earlier intervention, recognition of the psychosocial, rehabilitative, and recovery needs of patients, and the importance of working more effectively with families, and the value of integrating care for mental health, chemical dependency, and primary care conditions. However, it wasn't until 2015 that another politician would really take note of the broken mental health system within our country, and that it wasn't meeting our needs. The Helping Families in Crisis Act was sponsored by Representative Tim Murphy, a Republican from Pennsylvania and a psychologist. He introduced this bill to the House on June 5, 2015, and it was eventually passed by the Senate on July 14, 2016. The purpose of the Helping Families in Crisis Act is to strengthen and improve the mental health system across all settings. As a result, persons experiencing a psychiatric emergency can receive treatment sooner in a manner that provides them with both dignity and respect. Now, this act advocates for the following: specialized training to law enforcement, correction officers, and first responders. It provides grants for pediatric telepsych, the introduction of peer support professionals, as well as grants for loan repayments for mental health professionals. It extends the Garrett Lee Smith Memorial Act, which provides suicide prevention services for all ages, provides grants for early intervention mental health services, as well as treatment programs for children. It promotes the integration of medical and mental health care so that the whole person is treated, and also provides for same-day billing for Medicaid services. It requires that federal agencies collaborate and improve compliance across all settings within the mental health parity law. It requires the creation of an independent grievance procedure. It limits inpatient psychiatric hospitalization stays for adults who are receiving Medicaid to 15 days per month. And it creates a new Assistant Secretary for Mental Health and Substance Abuse. Moving on. Now, it appears that John F. Kennedy was moving in the right direction with the Community Health Centers Act of 1963 and was ahead of his time in regards to community-based mental health treatment. However, over the past 50 years, that act had failed to keep up with the growing needs of the people in this country. And as a result, we have been left with a mental health system that is broken, which has ultimately cost innocent lives, and has been racing against the clock to find an adequate solution. Now, while millions of Americans suffer from mental illness, only a very small number engage in unspeakable acts of violence against themselves or others. Yet many tragedies that we have witnessed in recent years might have been prevented had the proper resources been in place to support a timely diagnosis, early intervention, and effective treatment for those struggling with a severe mental illness. Hopefully, with the Helping Families in Crisis Act, mental treatment can be administered sooner with less individuals falling through the cracks of a currently broken system. Thank you.